So what's the biggest risk of testosterone replacement? A lot of times if you go to your doctor, they'll give you a bunch of risks of testosterone. That including, at risk of prostate cancer, blood clots, strokes, heart attacks, you name it, they'll give you all these risks. But in reality, when you look at the research studies, that does not show that that's the case. The people that are on testosterone replacement do not have greater risk of prostate cancer than the people that are not on testosterone replacement. The people that are on testosterone replacement do not have higher rates of blood clots than the people that are not on testosterone replacement. So they say it's a risk, but it's really a perceived risk. If the risk of having higher testosterone levels was clotting or heart attacks or strokes, then why are younger men not experiencing all those issues? If there were those risks of testosterone replacement, like blood clots, strokes, heart attacks, prostate cancer, then younger folks would be getting those. The men that are in their early 20s would be getting all those issues, but that's not the case. I would say the true risk of testosterone replacement therapy is that when you give yourself an injection, your brain sees that as your own testosterone. So it's a good thing, but a bad thing at the same time. So when your brain notices, hey, your levels are, say, double what they used to be, your brain thinks it's making it. So it starts it stops sending that signal to your testicles to make testosterone, to make sperm, because it thinks you're already making it. 2 months in, most of your testosterone that's in your bloodstream is from the injection rather than what your body's making. Your body sees that you have higher testosterone levels, so it does shut down that natural production. So your natural testosterone production goes down and your sperm goes down as well. Some people notice some testicular atrophy as well, about 20 to 30% decrease. So if you think of your testicles as a muscle, your brain is not sending a signal for them to work, and then when they're not working, you have some atrophy going on. But relatively speaking, I would say that's the biggest risk. When you give yourself testosterone, if you want to maintain those levels, you have to maintain giving yourself that injection. I always say a year in, you have to make that decision. Do you want to stay on the testosterone, potentially for life, or get off of this testosterone and restart your natural production to the best of its effect? Now, 1 year is just a benchmark. You can get off in 5 years, 10 years. It's whenever you want to stop feeling good in reality. Because once you get off the testosterone, your symptoms will return to where you are now. So in summary, testosterone does suppress your natural production of testosterone and sperm. So in turn, you're relying on the injection to make your levels higher. And you can get off at any time you want to, but there's a couple agents that we give you to restart your natural production of testosterone to its fullest extent. If you have any questions, reach out to us at RochesterTRT@gmail.com or 585-524-0300. You can call us or text us, whatever works for you.